Mr. President, Senator Benson, first of all, on the underlying amendment, I think it's a little deceptive to suggest that people think that that certain types of health care reforms means everybody would be at the current Medicaid level, because even if you have a simpler system and less burden on doctors and providers, they may be compensated more at a lower rate than they are at a higher rate when they have more obligations that are wasteful and not helpful to the system. But on the provider tax, I think Senator Hayden had an amendment to offer that, and I think that was what he was going to offer very shortly, because I think it's a reasonable way to fund things. It's not my first choice. I'm not a big fan of the provider tax, but right now, if we take away the provider tax, as is going away unless we change it, if we take away the provider tax, we're going to have a big hole in the budget. And this bill is very carefully designed to try and make it look like we don't need the provider tax. And we'll get into that, of course, in the course of the discussion, I'm sure. But we're going to take away in this bill, we're going to take away a lot of things such as dental and vision care for some of the poorest people in the state. Be glad to talk about that more. We're cutting back significantly on a lot of the public health programs, and there's lots of shifts and funny money going on in this bill in order to suggest we don't need the provider tax. I think that I'm going to be voting to support to continue the provider tax, not as something I really like, but because it's something we've been needing. And I think some members of your caucus have proposed alternative taxes to the provider tax, which is another way to do it as well. But the bottom line is we have to pay for health care for people, and saying we're going to continue cutting back, and you say we're not cutting, but I can guarantee you the people who are losing their dental benefits will see it that way. We can cut back, and we can cut back, and we can cut back, and you shift things elsewhere in the budget, so we eliminate the CCAP program for a year. Numerous cuts in here for people with disabilities, capping the waiver program, cutting the number of people who are eligible for PCA services, very painful cuts on people. And that's done in a way the House doesn't do it because they don't eliminate the provider tax. So, Senator, I wish you would support doing this. I think Senator well, never mind. We were going to have this amendment later as well, but I happen to support repealing the repealer, which this amendment would do, this amendment to the amendment would do, but I will urge members to support this.